doing? Just stop. Wait, listen. You won't believe what's going on right now with the private versus public exchanges for healthcare. Come on, follow me, come on. What we have here is a tale of two doors. Public versus private exchange. They are your future. Not your future of what is, but your future of what may be. And that's why this episode is called Buyer Beware. So today I want to talk to you about something that's very serious. The public exchange. There's a lot of hype out there right now telling you that is your only option. And it is an option, but I want you to understand some of the underpinnings that could really cause you and your family a great deal of distress. One of them are that if you're going to use the public option, the public exchange, you should use it if you only need to have a subsidy. So what's a subsidy? That means you don't have enough money coming in that you can make a premium payment. So you're going to ask for it to be subsidized by the federal government. You need to understand that this is technically a form of Medicaid. And as such, doctors and hospitals have the right to refuse Medicaid in any form. Now, that means they get to refuse the public option, which means they refuse your health care. This has already begun. Many doctors are dropping out of the public networks. Where are they going, you ask? To the private networks, which we'll talk about in another episode. But I want you to understand, the choices that you thought you had prior, you won't have anymore, because they can't afford to operate under the confines of the cost structure for the public exchange. So understand again, if you're going to choose a public exchange, make sure you're doing it for the reason of a subsidy. So, just like this room around us, the white walls, the plain desk, the one light, the other above, it may or may not be what you need. And the thing is, with the public exchange, that's going to be what you're going to get. You're going to get what they tell you that needs to be included in your plan. You don't have any other options. Kind of like Nancy Pelosi said, you got to vote it in to see what's in it. You got to get in the public exchange, buy a plan before you'll get to know all the details. That means you're doing all of your homework. You, the do-it-yourselfer, the person who wants to make this most important choice of your family's life yourself, you got to do it all yourself. You need to go through the drug plans on every single option in the public policy that you're going to choose off the exchange. You need to know the cost for all the medications that your family is going to take. This is something you've never done before, and if you don't do it, the financial havoc you can wreak for yourself is not even calculated yet, because they're not even sure, because the plans aren't detailed enough to spell out exactly what the responsibilities are for the carrier. So if that sounds like trouble, it's because it is. So go through them, and the thing is, you're choosing to do the public option, you're choosing to do it by yourself, that's your choice. But remember, you can get people to help you. There are still agents out there that do that. There are agencies like mine at Cocapelli that do it. Whichever the case is, you can get help. But I can't stress enough how important it is that you do that piece of homework. So I want to recap, guys, what we went over. Understand that the public exchange gives you subsidies, and subsidies are a form of Medicaid. the primary reason you're going to go to the public exchange is to get a subsidy. The subsidies, though, or Medicaid, does not have to be accepted by doctors, does not have to be accepted by hospitals. So remember that. Also remember to do your homework on your drug plans. The drug formularies are referred to on the website. Go through them. Make sure that your family's medication is on there that you're taking. Because the costs that are involved with that, you have to make sure you can afford it. You don't have to do this alone. You can find health agents out there or people like Cocopelli and my firm, whichever you need to. You don't have to go it alone. But do the homework, because the choice you make there will be your whole family's consequence for the next year. And I can't emphasize that enough.